In this video, I will explain what mGluR2 agonists do and why they may be incredibly useful in treating mental illness in certain neurodegenerative diseases. First, let's look at how mGluR2 agonists work. mGluR2 stands for metabotropic glutamate receptor 2. These receptors decrease the level of presynaptic glutamate, especially in the amygdala, the brain's emotion center. Presynaptic refers to the area before the synapse, meaning it involves glutamate inside the neurons. Essentially, mGluR2 agonists reduce the level of glutamate before it reaches the synapse, leading to various effects. In the amygdala, this reduction weakens and decreases the number of signals sent by neurons containing the mGluR2 receptor. This calming effect can reduce neuroticism and the intensity of emotions, helping treat many mental illnesses. Next, we'll explore which mental illness mGluR2 agonists can potentially cure and where they might serve as adjunct treatments. One significant effect of activating the mGluR2 receptor is the decreased expression of kappa opioid receptors, which is the brain's stress receptor. The most obvious application of mGluR2 agonists is treating PTSD, as mGluR2 agonists can effectively cure PTSD by calming individuals and resetting their stress response. Drug addiction is another area where mGluR2 agonists show promise. The brain structure changes seen in drug addiction are very similar to those in PTSD. Rat studies have demonstrated that mGluR2 agonists can reduce or eliminate the consumption of many different addictive drugs. Borderline personality disorder could potentially be cured by mGluR2 agonists. BPD is characterized by a smaller, more sensitive amygdala, particularly the right amygdala, which is associated with negative emotions. mGluR2 agonists may help reduce this overall sensitivity, alleviating the severe symptoms of BPD. Anxiety disorders, too, could greatly be alleviated by the calming effects of mGluR2 agonists. Now let's look into treatments where mGluR2 agonists don't outright cure a condition, but would help manage it. Certain forms of depression, excluding melancholic depression, may benefit from mGluR2 agonists due to their ability to reduce the number of kappa opioid receptors. Interestingly, the melancholic depression is treated more effectively by mGluR2 antagonists, which have shown greater efficacy than ketamine. Schizophrenia can be treated with mGluR2 agonists, which help reduce the negative symptoms of the disorder, symptoms that are typically the hardest to treat. Autism is another condition that would be helped with mGluR2 agonists, as it reduces the sensitivity of the amygdala. Chronic pain might also be alleviated by mGluR2 agonists. While they are not traditional painkillers, they can reduce the negative feeling associated with pain, making it less bothersome and correcting the expression of the mu opioid receptor, the target of morphine. Alzheimer's disease and dementia are neurodegenerative diseases that could benefit from mGluR2 treatment as well. An impressive effect of mGluR2 agonists is their ability to increase stem cell production and differentiation, giving them an antioxidant properties and an anti-aging effect. Additionally, they can reduce suffering, which is linked to the kappa opioid receptor and its effects on dopamine. Anyone experiencing significant stress or suffering may find relief with mGluR2 agonists. In summary, mGluR2 agonists offer a wide range of therapeutic benefits for mental disorders and neurodegenerative diseases. They hold some potential for treating PTSD, drug addiction, borderline personality disorder, anxiety, some forms of depression, and schizophrenia. Additionally, they can serve as adjunct treatments for Alzheimer's disease, chronic pain, autism, and other various forms of suffering. I believe these medications have been withheld from the public despite early research showing their effectiveness in treating drug addiction and PTSD. To conclude, mGluR2 agonists offer hope for curing PTSD, drug addiction, borderline personality disorder, anxiety, some forms of depression, schizophrenia, while providing valuable adjunct treatment for Alzheimer's disease, chronic pain, autism, and many other forms of suffering.